In this video, we're going to talk about the body overview and how did Birthing Better Families have an understanding about our birthing body. When the skills first developed in the 1970s, 95% of us labored. And if you had a cesarean, you were given a general anesthetic. So we didn't think much about the body. We knew that 95% of women laboring did not mean that everybody had a good birth. Some people had short labors, others had labors that lasted for 4 or 5 days. That was normal, natural, and physiological and accepted, just as a dead baby was. Dead mothers were really not accepted, and that's why the medical profession did cesareans. It's a classical cesarean with a scar from your belly button to your pubic bone, and it was a major abdominal surgery. But 95% of us laboring was just that. Stuck baby, easy birth, loved the birth, hated the birth. Whatever it was, was. So Birthing Better Families at that time in the early 70s until the 1980s, when everything changed, we focused more on developing better skills around breathing, communication, touch, and tying those skills together with soft skills. But in the 1980s, when everything changed, and those changes were absolutely a tsunami of changes. Birth control, the pill. Safe and legal abortion, women demanding that they go into the workforce and work rather than just stay at home. The size of families decreased very rapidly. And believe it or not, fashion influenced the change in the medical profession. My generation, back then, in the late 70s, started to wear bikinis. And those of us who had had a classical cesarean didn't want to be left with the ugly scar on our belly. It's ugly. And many of us wanted to try for a vaginal birth after a cesarean. Why? Because we did not want to have long labors. And we were clear to the medical profession something had to change. So the medical profession came up with a bikini cut in response to us not wanting to have a scar on our belly, low line incision. And it turned out that separating the muscles of the uterus rather than cutting them permitted our uterus to respond better to an attempt to have a vaginal birth after a cesarean. And the result was more women having long labors, stuck babies, opted for a cesarean because we could also be awake and our husbands could be with us as they were when we were in labor. This is what we wanted back then. We lacked choices in the United States. Lamaze skills had been taught since the late 50s in almost every hospital in the United States. So the majority of us were using some level of skills. We had demanded our husbands be there and help us. And so during the 70s, when we started to develop Birthing Better, we lacked choices, had skills. All of us were using skills, even though we knew that philosophically Lamaze was targeting low-risk women. We coped better. In other words, we reduced the global childbirth goal number 2, which was suffering, and we coped better. We told better birth stories. We felt more empowered. We worked together with our husband. 1980s, the natural birth movement shifted their focus totally away from skills. Cows and cats aren't taught, women don't need to. Fathers should not coach, and women just need choices. Low-risk women who had choices could then choose to have a natural birth, pain-free labor without medical interventions. It is complicated. And our response as Birthing Better Families was to develop skills. More skills, more skills, more skills. Because long labors were no longer accepted. Stuck babies were not accepted. Posterior births were considered to be normal and delivered vaginally. So were breech births, so were twins. But families didn't want to take risks. So they would prefer to have a surgical birth, be awake with their partner there, than to risk their babies in a long labor that the baby was stuck, or with twins, or with breeches, and then even with posterior births. So the overview of the body came from my background as a body worker. My first training was in kinesiology, muscle testing, and then in osteopathy. So unlike ICPA members that are chiropractors and working with the bony structure, and they may be using kinesiology as well, which is working with muscles or the soft tissue, I come from working with fascia or connective tissue in the body. And I brought those skills into working with the families, who then developed skills to answer questions like, what if I could have, could we have, what about? And so in the 1980s, when the cesarean rate rose from 5% to 15%, we started to look at skills to do something. And it turned out that doing something had to do with the body, because there was a big object in a container. And as dads looked at their pregnant partner with a big belly, they knew big object has to come down through and out, can't change the object. Can we change the container? And the good news is yes. And the good news further is we all blink, we all cough, and we can all tighten up our rectum, which meant that all of the body skills that could be done on women's bodies could be done on men's bodies as well, which meant that when men feel the changes in their body, they know what they're doing on the woman's body. We realized right away that there were two elements to the body: the bony structure, the pelvis, and everything that covered it, all the soft tissue. And the soft tissue is a massive system. It includes our skin, doesn't include fat. It includes our muscles, our ligaments, our tendons, and all the stuff that holds all of that together. Now, the connective tissue is a massive system, and it's one piece. And the other thing about it is that it stores memory. Muscles don't. Muscles can be tight for about 7 seconds, and then they lose their strength. But connective tissue stores memory like an elephant. How do we know this, even if we don't have any science training? I don't have science training because I didn't want to be perceived of as a practitioner who could treat, diagnose, or prescribe anything. I just wanted to be a body worker. So I had to understand this in a common knowledge manner and pass it on in a common knowledge manner. And that meant that all of us who were developing the skills for our births, we knew that if something worked for us and we could explain it to someone else, that it couldn't possibly work for them. So how did we know that connective tissue stored memory? Because if you watch somebody walking down the street like that, that is a habit. You can even see my shoulders. One's higher than the other, isn't it? So if I lift that up, that's more in alignment. And I have a habit. And many of us have a habit. That's the storage of memory in the connective tissue. We feel it more dramatically if we twist our ankle. We can go to a doctor or a natural health provider, and they can say, yes, there's inflammation. You've torn a ligament, torn some muscles, but at some point we heal, and we're told by our care provider, you're healed. And yet we feel that there's a weakness in our ankle. That is the stored memory. So in this body overview, you need to understand there's going to be another video on the bony structure and another video on the soft tissue. The soft tissue controls the bony structure. And what you'll learn is that there are tensions in that soft tissue that can stop us from opening up and creating space for our baby, and can stop our baby from opening us up and moving down, through, and out.